Hello everyone, I'm Dr. Srijitra from Examla Healthcare. Today I'm here to discuss a new topic, physiotherapy. What is physiotherapy? What is the scope of physiotherapy? How does this physiotherapy works? All these things we will discuss in detail today. And what is physiotherapy? Physiotherapy is nothing but the artificial stimulation of the human body, especially that of the muscles, so that you can relieve pain, you can relieve the swelling, you can relieve the inflammation, or you can elicit more movement and reduce the stiffness and things like that. And this we can elicit either through manually or through electronic means. If you look into the evolutionary history of physiotherapy, you can see that it dates way back. Especially in the Chinese medication, if you see that physiotherapy and acupuncture, Reiki and things like that has been studied in detail, and they have meticulously designed so that you can elicit certain response and elicit cure from these process. And still it has been very popular in our country. Physiotherapy is nothing but the artificial stimulation of the human body, especially that of the muscles, so that you can relieve pain, you can relieve the swelling, you can relieve the inflammation, or you can elicit more movement and reduce the stiffness and things like that. And this we can elicit either through manually or through electronic means. We have different kinds of varieties of machines which can elicit or which can produce certain frequencies, and these frequencies are used to bring down the symptoms like that of the pain or stiffness or that of inflammations and swelling. These machines are capable of doing it. Rather than doing it manually, these machines are capable of doing it. Muscle is also one of the most important organ of our body. The function of the muscle is not entirely on keeping the body structure or keeping the joint structure or keeping all the bones together. They have much more higher functions. So after a period of time, your strength of muscles comes down, your core muscle capacity comes down, the resilience or the functioning capacity to contract and relax will start coming down, and that is the reason why most of you people will end up in some or other kind of diseases, both lifestyle diseases as well as some joint related diseases. Physiotherapy has a major role to play to strengthen your muscles, to stimulate your muscles, or to relieve pains and swellings and things like that. Starting with, physiotherapy acts as a preventive care. In today's world, most of us are doing sitting jobs. You see, if it is IT profession, even if as a doctor, we are all into the sitting jobs. So what happens is our back are extremely stretched, and the neck is also extremely stretched. The lower back area and the neck area are the most commonly affected area of our current generation, because we are overly stretching these muscles. So over the period of time, if you don't have proper exercise and care, you will start getting aches and pains, stiffness and uneasiness around neck, around the lower back. So this is where the physiotherapy comes in place as a preventive care, because once you start doing the physiotherapy, you will be able to relieve the too much of stress which is giving you the lower back pain or the neck pain. Because if you do physiotherapy at the proper time, because we can prevent these aches and pains to going into certain serious diseases like cervical spondylosis or lumbar spondylosis or IVDP. So you can prevent these symptoms into progressing into some serious diseases. So the second is physiotherapy as treatment. If you look into the osteoarthritis or rheumatoid arthritis or frozen shoulder or tennis elbows, any kind of joint diseases are either inflammatory or degenerative. So this can give rise to a lot of symptoms like pain, swelling, inflammation, redness. Along with the medications, we will be advising physiotherapy for these patients, because as you know, there is a very chronic condition, and physiotherapy will act as a symptom reliever, because it will be able to help in relieving the pain, it will be help in relieving the swelling, inflammation. The physiotherapy has to be periodical, either according to the symptoms of the patient. It has to be repeated 6 months once or 1 year yearly once. You will be able to maintain that symptomless stage, and you can at least arrest the progress of the disease. And the third one is physiotherapy as rehabilitation. So if you met with an accident, either a road accident or some other kind of accident, like cardiovascular accidents like stroke or paralysis, you'll be ending up with loss of movement. So here physiotherapy acts as a rehabilitation method, so that your movement can be revived again, your sensations can be revived again. So here what you have to understand is, it is very important to take treatment in as early as possible, because as the muscle goes weakened or as the nerves go damaged, it is very difficult to revive you back to normal condition. And let's see how physiotherapy works. in modern day physiotherapy, a lot of research, a lot of studies has done to understand what is this frequency, how does this affect the muscles, and what are the type of muscles, and how does each vibrations help in stimulating the muscles, how does certain vibrations help in stimulating the nerves. There are a lot of researches done on it, and accordingly they have come up with a lot of machines. So we have different machines to give out different frequency vibrations, and each vibrations have very specific functions to do. Certain vibrations will give that muscle relaxation, and certain vibrations will promote that contraction and relaxation of the muscles, and certain vibrations will help in the vasodilation. Vasodilation in the sense that the arteries will be dilated, so that if you have that swelling, water retention, and this will be flushed out back to the system. So here what happens is there will be a lot of hormones and there will be a lot of minerals which will be trapped in the joints because of the water retention, especially the hormones like endorphins, because these are the pain hormones. Because of this you are getting a lot of inflammations and pains. So once the vasodilation happens, these things will be flushed out back to the system, so that immediately you will be relieved of the pain, immediately you will be relieved of the swelling and the inflammatory sign. If you have any queries or doubts, you please do reach out to us either through mail or through comment. Definitely we will be giving you all the required answers. And if you do like the video, you please make sure to like, comment and share, and also please don't forget to subscribe. Thank you so much.